Hi YouTube, my name is Renee Harris and I would like to talk to you for a few minutes on the rise in health care in the United States. So did you know 1 in 5 adults visit the emergency room a day? This can be a problem with health care. Not only do 1 in 5 visit the emergency room, but there are certain illnesses that can help affect the healthcare industry. Such illness as AIDS, cancer, diabetes, high blood pressure, emphysema, obesity, sickle cell, just to name a few. So other factors that could affect the healthcare business are a rise in fraudulent claims that are being billed by hospitals and doctors. There are doctors that are building insurance companies for procedures that are never being performed on patients. So with the healthcare business, it's a booming business. There's a lot of money that could be made from it. So we all know that. And I want to talk about pre-existing conditions. Pre-existing conditions such as being diagnosed with cancer. So I want to talk about an issue that's close to my heart. One of my dear friends has a son for over a year, had been going back and forth to the hospital. And the hospital kept sending this young man home for over a year. And someone recommended him go farther out to a hospital. Well, he's 23 years old. When he went to the hospital farther out, they immediately diagnosed him with having cancer. Well, he has prostate cancer. We found out a few months ago. But for the last year, he's been going back to the doctor and the hospital, and they kept sending him home. So we're paying for doctors to misdiagnose people. As a taxpayer, I think they should do their job right. Don't get paid for services and you're misdiagnosing people. You're putting people's life at stake. Not only that, but I would also like to talk about the factor of doctors being overpaid and the hospitals being overpaid. Okay, and then I would like to talk about other factors that could make a rise in healthcare is people not having no insurance at all. And that's something that we all need to consider. Because back in 1960, as I did research, I come to find out that healthcare was only $146 per year versus 2010, which is by the same healthcare, the same procedures from 1960 to this time in 2010 went to $9,990 per person. Why the drastic increase? No one can explain it to us. Same procedure. As we know, in 2010, Obama came up with Affordable Care Act. With the Affordable Care Act, it is mandatory that everyone has insurance, health insurance, which is a good thing. I think we all need health insurance, but we need to be more wisely when using our health insurance. We need to be more wisely with what we are eating, because obesity does affect a lot of African American people. Let's just be real about it. That's all.